Hi, my name is Dr. Daniel Ehrman. I'm an assistant professor at the Huntsman Cancer Institute at the University of Utah. My disease-specific focus is in lymphoma and chronic lymphocytic leukemia. CLL and SLL, these stand for chronic lymphocytic leukemia and small lymphocytic lymphoma. So these are disorders of the B cells of the immune system, and specifically the B lymphocytes. These types of cells are seen all throughout the body, but specifically they're most commonly seen in the blood, the lymph nodes, the bone marrow, and the spleen. Chronic lymphocytic leukemia or small lymphocytic lymphoma, these cancers arise when the cancerous B cells proliferate at an unexpected rate, and over time they increase in the blood. And we can actually diagnose this malignancy by specific blood tests that we run. What we most commonly see is patients that are newly diagnosed with CLL or SLL are actually asymptomatic at diagnosis. A common story we hear is a patient went in for a routine checkup, their annual blood test and physical examination, and their doctor tells them that their white blood cell count is high, and he usually will run another test following that called a flow cytometry. And it's at that point that patients can get diagnosed with CLL. Typically what we see is at first diagnosis, about a third of patients are completely asymptomatic. Another third of patients do have some symptoms in regards to their CLL, and then another third of patients will develop symptoms of their CLL shortly thereafter. As a blood disorder, CLL and SLL are diagnosed specifically from a blood test called a complete blood count. So your doctor will see you, do a complete blood count as part of routine screening, and then following that, he'll order something called a flow cytometry if he sees the white blood cell count is high. And the flow cytometry looks at the specific populations in the blood and can from there diagnose CLL. Some patients with SLL may not have the white blood cell count high enough. However, if they do have enlarged lymph nodes, the lymph nodes can be in the neck, they can be under the arms or in the groin region. And if those lymph nodes are enlarged, further testing can confirm a diagnosis of CLL or SLL. Fortunately, there's been tremendous progress in the field of CLL over the last 10 years. Starting in 2014, there was a drug called ibrutinib, which was approved. This drug is known as what's called a BTK inhibitor, or a Bruton's tyrosine kinase inhibitor. Ever since that point, we've actually shifted away from the previous paradigms for treating CLL, which previously was what's called chemoimmunotherapy, and now we focus more on what's called targeted therapy. So when you see your cancer doctor specialist, he may discuss frontline therapy, and most likely he'll discuss targeted therapy, he or she. And the options will be things like venetoclax, which is a BCL2 inhibitor, acalabrutinib, ibrutinib, or zanubrutinib, which are BTK inhibitors, and potentially drugs that are called monoclonal antibodies that target CD20, like obinutuzumab or rituximab. The nice thing about targeted therapy is, unlike chemotherapy, it doesn't affect every cell in your body. So targeted therapy specifically hits only the marker that it's meant to hit. And in the cases when we treat CLL, what we see is a vastly different side effect, adverse effect profile. And so patients can have much better quality of life when they're treated with targeted therapy as opposed to chemotherapy. And that's exactly what we've seen in the clinic. Once we talk about relapse refractory disease, these are patients that most of the time will be treated already with venetoclax, obinutuzumab, or a BTK inhibitor. What we generally try to do is, if you haven't received one of those, we give them in the second line setting, and depending on how long it's been since your CLL or SLL has come back, sometimes we can actually retreat safely with venetoclax again over time. However, we do run into the problem where once you've received too many of these therapies, we have to think of other options, and it's at that point where I would highly recommend consulting with a CLL or SLL specialist in your area, because CLL is an area where we have actually fantastic clinical trials, and in the relapse refractory setting, we're seeing great results with our clinical trials. Most recently discussed is something called pirtobrutinib, and the difference between these newer BTK inhibitors compared to the older ones is that instead of binding what we call covalently, meaning permanently binding, these newer BTK inhibitors are what's called reversible binding. And so because of that, they can sometimes overcome resistance to previous BTK inhibitors. Additionally, we have other treatments coming down the road that look at targeting other things, including BTK degraders, which actually completely destroy the BTK protein instead of inhibiting it. We have what's called cellular therapies that are on the way. Cellular therapies include things like CAR-T, which stands for chimeric antigen receptor T cell therapy. And then we have other treatments called something called bispecific therapy. And these newer cellular therapies actually use the immune system to fight the cancer for you. When I first see a new patient, I try to, one, assess their symptoms. If patients are having symptoms at diagnosis, they may potentially need treatment sooner. The other thing I try to do is assess how much tumor volume do they have. And if they have a lot of tumor volume, I also may think that they may need treatment sooner. But the vast majority of patients at diagnosis will be asymptomatic. The most important thing that we do at diagnosis is what's called prognostic testing. Prognostic testing really paints the picture of how your CLL will develop in the future and kind of what to expect. Will you need treatment in a few years or many years, or you never need treatment? And we have very specific testing that we do on the blood that can help paint that picture for us. The Lymphoma Research Foundation is one of my most highly recommended resources for newly diagnosed patients. And the reason why is that there's absolutely a plethora of information for patients to read, support groups that they can find, and fantastic information that can help reassure them about their diagnosis and what their doctor may be saying, but also let them know that they can see a CLL or SLL specialist in their area. That's what we do at Huntsman.